Hi, I'm Callie Sullivan, a dietitian with Alberta Health Services. I have lots of experience working with people with IBS and IBS-like symptoms, helping them to explore the role that food can play in managing those symptoms. Over the next few minutes, I will share with you some of the common questions asked about nutrition and IBS.
What I eat seems to impact my IBS symptoms. How can I figure out which foods to eat and which foods to avoid?
It is important to know that food does not cause IBS, but changes to what you eat may help reduce symptoms. Each person with IBS may have different symptoms related to food, drink, feelings, and activities, so keeping track in a food diary is an important first step to figuring out what works for you. Your diary should include what, when, and how much you eat. IBS symptoms such as pain, gas, bloating, diarrhea, and constipation. Feelings such as happiness, stress, and anxiety, as well as activity patterns and sleep patterns.
My neighbor says a gluten-free diet was very helpful for her. Should I try a gluten-free diet?
People diagnosed with IBS are usually screened for celiac disease, as the symptoms of celiac disease can be very similar to IBS. If you have not been screened for celiac disease, talk to your doctor. Do not try a gluten-free diet until testing has been done. If you are diagnosed with celiac disease, treatment is a gluten-free diet. Gluten is the protein that is found in wheat, rye, spelt, and barley. If you do not have celiac disease, but still feel your symptoms could be related to gluten, talk to a registered dietitian. A registered dietitian can help you determine if you are indeed sensitive to the carbohydrates in wheat. Following a wheat-free diet may be less restrictive than a gluten-free diet and may be of benefit to you.
My grandmother always said fiber would help me be regular. Should I start eating bran cereals that contain fiber?
Fiber is the non-digestible portion of plant foods that can help soften stools and provide bulk to stools. A low-fiber diet can contribute to both diarrhea and constipation in people with IBS. There are two types of fiber, soluble and insoluble. Insoluble fiber, like wheat bran cereals and bran muffins, may make symptoms worse. Soluble fiber, like oatmeal, oat bran, psyllium, ground flax seeds, and fruits like oranges and strawberries may help symptoms improve. Try adding 1 serving per day of soluble fiber-rich foods to your diet. Remember, fiber needs lots of fluids to work properly, so aim for 9 to 13 cups of fluids per day.
My friend who also has IBS mentioned the FODMAPs diet to me. What is this diet?
FODMAPs is a diet that focuses on reducing fermentable carbohydrates like oligosaccharides found in wheat, lentils, and beans, disaccharides like lactose found in dairy products, monosaccharides found in fruits and in some processed foods, and polyols often found in sugar-free and diet foods. A low FODMAP diet can be helpful for some people with IBS, but it is difficult to follow as it restricts many common foods. A registered dietitian can help determine if this diet is right for you and help you to meet your nutrition needs. Some people may benefit by reducing individual fermentable carbohydrates separately, for example, only removing lactose. Your food and symptom diary will help you figure out which, if any, foods could be removed from your diet for a short period of time to see if it improves symptoms.
Where can I look for more information about IBS and nutrition? How do I speak with a registered dietitian?
The Alberta Healthy Living Program offers classes for people with IBS, such as the Eating Well and Managing Irritable Bowel Syndrome class, or a celiac class, which are taught by registered dietitians. Individual appointments with registered dietitians are also available. You can go to this website or call this phone number for more information or to self-register.